So we're here at the HBOT News Network with Dr. Harch. I'm blessed to have him in the continuing conversation. And in this segment, we're going to focus on strokes. And strokes, of course, have major impact on the brain, and we've been covering some of the brain topics. And so welcome, Dr. Harch, and thank you for being here to cover strokes with us.
My pleasure. So, great to be here.
So in your experience, and I'm curious from the standpoint of strokes, you've been treating stroke victims, I guess, through much of your career. Is that true?
Yes.
What can you tell us about strokes that would be valuable for them?
This is the most effective therapy for strokes. And it goes back to our discussions on wounding and such. And the concept was rooted in this idea that brain cells don't have to die, that they can be partially injured, and that you can actually revive them. And this was pointed out by my mentor in a letter to The Lancet, which was the famous medical journal we have talked about before, in 1990. And it's been termed the idling neuron letter, that a neuron can be dead or alive and functional, but it can also be in this kind of intermediate state where it's been injured and knocked down to an idling level. Doesn't have enough metabolic capacity, oxygen, blood flow, whatever, to send its electrical signals. And if the neuron can't send its electrical signals, it's as good as dead in that it can't give you function.
What causes it to get into that state where it's in the middle?
Lowering of blood flow and oxygen level. So what's been shown is that we have, on average, a certain amount of blood flow going to your brain. And when you're, like I am active now, moving my hands and talking, those areas of the brain responsible for all that activity are going a whole lot faster. Their RPMs like in an engine. It's all revved up, the metabolism's going, and there's much more blood flow to it. But at rest, just sitting here not doing anything, there's a certain basal level. When there's been an injury like a stroke, what's been shown is that as the blood flow gets lowered to different areas and different levels.
It's like from a blockage.
Correct. Like a blockage in the artery, a blood clot. The cells go through different stress states where they turn on different genes. They get to a point at about 60% reduction in blood flow where they no longer have enough oxygen and blood flow and sugar and fat to generate electrical signals. It's called electrical silence. But they don't actually die until that's been dropped another 60%. So they can live in that state of idling, if you will, that low basal state. So what Dr. Neubauer did, and he had been treating strokes for years, he had published in 1980 a study with, I can't remember the numbers, how many stroke patients he had treated, acute stroke, subacute period, chronic period even. But he was never able to image what he was doing on CT scan. Or by 1990, even MRI was not quite in vogue yet, but never could get a picture of it until he did a brain blood flow scan. So think of it, stroke, the most common form is a blood clot in an artery, forms at an area of, irregularity, atherosclerosis in the artery, or a blood clot that comes from, let's say, the heart and goes and plugs the artery. But what happens is downstream, there's no blood flow. So you've got almost a sphere of brain of varying size, depending on the blood vessel, where there's no blood flow, and it has to trickle in from the surrounding areas of brain. And as it does and trickles down, the cells it passes take oxygen out of it. So what you end up with is a gradient of amount of blood flow and oxygen to the center. Well, when you get down to that threshold point of death, the cells die. But in this region here is something you can do something about. So what they did was take this lady who is 60 years old, 14 years post-stroke, affected the whole side of her body. She's paralyzed, drooling, can't eat, has a PEG tube, no speech, and totally dependent. And it can't even sit up. She's in a semi-reclining, this Jerry chair. And he did a SPECT brain scan, and you could see the huge deficit. And you can see it on CT scan, the anatomic equivalent. But the blood flow on the blood flow scan, there's none in that area. They then put her in the chamber, took her out, and repeated the brain scan. And right in the center of, on the CT scan, looked like the deadest area. It lit up with blood flow and metabolism. Turns out it was the area that controlled all facial motor. So lips, tongue, mouth, speech, etc. And shoulder function and leg function, not the hand and arm. Over the next 16 months, they treated her with intermittent hyperbaric oxygen and face mask oxygen intermittently, normal baric oxygen, in the nursing home. She reacquired her speech, stopped drooling, was able to eat. They got rid of the peg tube, and they were able to get her up with assisted ambulation. And what the article was saying is, after 14 years of stroke, wait a minute, the concept that we've had in neurology all these years that brain cells are either dead or alive after a stroke or an injury, no. Maybe we can have some injured ones that under the right stimulation, in this case pressure and oxygen, can be revived. And that set the foundation for what we were doing right at that time then, starting to look with the brain imaging and assess people who could respond. We do a scan, one treatment, rescan. And it's identifying that salvageable tissue and then treating it.
Now, I know I've read a little bit about the potential, and maybe this was used somewhere where they basically had the ambulance as a hyperbaric chamber, and someone had a stroke. They put them immediately in it and drove the oxygen into the blood plasma.
This was done in England.
Got past the clot or the blockage, and so you didn't have that long period of time where, as you said earlier, you dropped, basically to zero, and you have cell death.
Right.
And that's another thing, like the cerebral palsy, giving every child that's born with with or without the knowledge of any injury, because that doesn't show up for a period of time anyway. It is just a quick hyperbaric treatment could really solve a lot of the ills of cerebral palsy. This could also, in effect, prevent the damage done from stroke victims.
Or minimize it. Yes.
Like a massive stroke would not have such serious effects as you've just described.
Correct. And with the clot dissolving drug that's now used for treatment of stroke, once you dissolve that clot, you now have what? Reperfusion injury. So coupling the hyperbaric oxygen with the clot dissolving drug. And in 1997, right here in North Carolina, at the Gray-Lynn Conference Center in Winston-Salem, Wake Forest, Bowman Gray University Medical School, Dr. Jim Toole, who is a famous neurologist, held a conference on hyperbaric oxygen stroke, brought all the people, and it was my senior partner, Dr. Keith Van Meter, who proposed, why don't we look at doing hyperbaric ambulance? And in fact, right now, he is developing one, and they're in the final prototypic construction of it with NASA down in New Orleans.
To actually do that.
Yes.
Wouldn't that be wonderful
to
have that?
And so that is underway. It's a huge project, but they're very close. They have some investors who are helping fund it.
So there's a large group in the United States that have strokes. We know that.
Yes.
And what percentage of them are actually getting hyperbaric oxygen is relatively small.
Extremely small.
Yeah.
I mean, I think there are 800,000 strokes per year in the U.S. roughly. Mm-hmm. It's a huge number. In fact, I talk about it at the exact time Dr. Neubauer was publishing that article in Lancet. We had an almost equivalent case, Mr. H, who was 12 years post-stroke and was mute. Never said a word and completely amotivational, just laid there in bed. He could move. But his wife, of course, couldn't take care of him and finally had to put him in a nursing home. And every month she'd go and visit him and say hi and all this stuff, but you can imagine, no speech, no communication, nothing, and had been this way for 12 years. Well, just laying in bed, he developed bed sores on his heels. So he got sent to our wound care unit for wound care, and the plastic surgeon saw them, and the plastic surgeon said, okay, we're going to do a flap closure, cut the ulcer out and advanced tissue, plastic surgery. We're going to close those wounds, and yes, you can do hyperbaric oxygen with it. It'll help.
Because of wound care.
Correct. So we started treating him. And we got about 10, 12 treatments in, and the stretcher van that would bring him in every day, he'd come through and he was just crying. And of course he's mute and he couldn't write. I'm the doctor and I'm going, what's going on with this guy? And so I'm doing the workup, and he can't talk. We got to look for the problem, head to toe. I'm doing tests, examining, couldn't find anything. I said, this is odd. We kept treating him. This was 1990. Kept treating him. We got to about 15, 18 treatments. Stretcher van brings him in. And he does this to me. Comes through the double doors and he's doing this. And I'm looking. I'm saying, is anybody looking at Mr. H? 12 years the guy's been like a stiff in bed. And now he's waving to us. Another 10 treatments, and he starts talking. And about that time, the stretcher van brings him in that day, and behind him is his wife. And remember the old Wendy's Where's the Beef commercials? Clara, where's the beef? She was a spitting image of that lady. And she comes through the double doors, and she goes, where's the doctor? And I go, I'm the doctor. She said, what did you do to my husband? The translation was, I may have to take him home now after 12 years. But, she said, he's talking to me. What happened here? And I said, I don't know. We're doing this hyperbaric treatment, and maybe this is what's happening to these divers and the boxers. His brain's waking up. No, this was idling neurons that we were treating in this guy. And reactivating these injured areas that weren't yet dead. And I was like, wow, what do we have here? I mean, it was another one of these cases that helped really shape my whole career. Mr. H, thank you.
You have in your forward here is Dr. Bill Duncan.
Yes.
And so
God bless him.
So in 2014, when I first heard you speak,
yes,
I met Bill, and then at some point got a group together of retired generals and chiropractors and doctors, and Bill flew Bill in to do a presentation.
Yes.
So that night we had dinner at my house, and so I have Chuck and Linda Bush with me, and so I just turned to Bill and I said Bill, from what I understand, because I started out a major skeptic, like, how come I don't know about this? There's got to be something here, like, got to dig. So at that point, I'm pretty convinced in all that I'm reading, and I've read your book, and I've read a lot of research or clinical trials. And I said, Bill, from what I understand, hyperbaric oxygen, the only thing it can't do is bring back the dead. And I said, but it can bring back the half dead. And Bill said to me, he said, that's not entirely true.
That is, Bill is right.
And then he talked about a case where some young man was in the Mississippi River down 29 minutes.
It's my seat.
Brought him up, and so maybe you can tell us a little bit about that, because stroke victims have, they're not encouraged and they have no hope.
Right.
And wherever we see them get into hyperbarics, there is some improvement.
As my wife, hyperbaric nurse, partner, I need to throw some superlatives in, characterize this therapy. It's hope for the hopeless. But yes, in 1983, a diver, and I have permission to use all these names that I have used, was in the Mississippi River, 90 feet, 80 some feet down, and they were salvaging a tugboat that had sunk, brand new tugboat. And anyways, it sunk in the river, and it's now encased in silt. And even with a crane, they cannot lift this thing off the bottom of the Mississippi. So they send down a diving crew with what's called an airlift. An airlift is an incredibly powerful vacuum cleaner. And it's a tube about this wide, has a steel bar across the bottom of it, so it doesn't suck up, trees and other stuff. But it's got a 1,000 horsepower diesel engine up on the deck of the boat or barge. And it's literally vacuuming up. Oh, and the key thing, they put a high pressure air line down there and they inject air into it. So by Boyle's law, which is part of what we do in hyperbaric medicine, one of the universal gas laws. That gas down there coming out under pressure now comes to the surface, and as it does, it expands. And what it does is pull a tremendous vacuum that's augmented by that 1,000 horsepower diesel engine. And it will shoot mud off the Mississippi, vacuum it off the floor of the Mississippi River, 100 feet in the air, shoot it out. So this diver's down there with this airlift, suctioning silt to loosen up, and he got sucked up into it against the bar. Helmet came off, so now he's got this huge vacuum on him, and he arrests. He's dead. And they send another diver down to get him, and 2 divers down, and the 2 divers can't find him. The 2 divers find each other. Eventually they get this guy, they bring him up, and they lay him out on the deck of the barge, and it's like a dead fish, just, I mean, dead as dead. And they decided, well, maybe decompression sickness is part of this. They put him in a hyperbaric chamber, take him to 6 atmospheres of pressure. So the clinical chambers go to maximum 3. This is 165 feet of pressure, and they put him on pure oxygen. His head was swollen, hugely swollen. You couldn't see eyes, nose, mouth, anything. They just put the mask on him here, hoping that there's somewhere an opening in there. Took him to 165 feet, and the lung volume collapses and will suck air in. He entrained the oxygen, sparked up, came to life, wide awake, and now this high free flow oxygen at 6 atmospheres in the chamber, the inside tender is breathing, gets oxygen toxic, and has a seizure. And this resuscitated diver now is tending to the seizure, telling him, Jim, you're going to be okay, just hang on. They got this all recorded. Anyways, it was a total save resuscitation. He was dead for 25 minutes. Cardiac arrest for 25 minutes.
Well,
That's what the estimate was. And we just had him back. Now, I think he died a few years ago of a heart attack. But a number of years ago in New Orleans, we had him back, had him 23 years afterwards, completely psychometrically tested, everything, SPECT brain scan, IQ was 123. He had worked for years.
Totally
bring back the dead.
Totally brought him back. And one of the things
and then they did it on pigs. 25-minute cardiac arrest, resuscitated him. Pigs and rats. Go ahead. I'm sorry.
Well, no, I mean, it's one of the roadblocks is, have they done any animal studies?
Oh, yes.
Of course, they've done.
After him, and he tried to report it, they said, well, just like they did to me, I wouldn't believe, that's not believable until you have an animal study. So he went and did it in guinea pigs, got the same result. Well, that's guinea pigs, doesn't really apply. You got to do it in a bigger animal. So then he did it in pigs, got the same result.
Well, so you raised an issue that also I find in the research.
Yes.
And they talk about the risk. In fact, doctors will say, oh, don't use hyperbarics. Oxygen toxicity is a real thing. So when you're giving a treatment and perchance you have oxygen toxicity, and so you remove the oxygen, the pressure, and you stop drinking the Kool-Aid, as we might say.
Yeah.
What sort of serious damage occurs from the oxygen toxicity? Is there any?
No, it depends. For the acute episode like you're talking about, the only time you ever see that, or I should say almost the only time you ever see that, is in the acute, extremely injured, ill people, like carbon monoxide poisoning, gas gangrene, comatose people. And those people, when treated at the highest pressures, it's been shown 3% of them can have a seizure. But true oxygen toxicity seizures are thought not to cause any permanent damage. They're quick-lived, and the patients usually bounce back from it. Now, this is, oxygen sensitivity of an acutely injured brain. Mm-hmm. We don't know that it's causing any, but the other 97% that are getting it and don't have a seizure, it's beneficial. So it is a very small percent. And when we look at the clinical walking people that are treated with hyperbaric oxygen in an outpatient setting for standard wound care and so on, I mean, the rate of an oxygen toxicity seizure is 1 in 10,000 to 1 in 60,000.
Yeah, so
It's extremely...
Yeah, I know in the local clinic here at Ex Vita, they've done, well over 10,000 treatments, have never even witnessed anything
Well,
like
that's
that.
for seizures, yes. But you can get oxidative stress and overdosing at, with not as Florida manifestation. And if you ignore that and keep treating people in that setting, yeah, there can be some injury.
So the sort of the statement that we had talked about earlier is that if you're getting hyperbaric treatments and you're continuing to see improvement, keep going. If
Yes.
it stops, stop, take a break. I mean,
Exactly.
it's like anything.
Yes.
Too much of something is just that.
It's a practice of medicine, yes.
Yeah. Well, thank you again for covering an important topic, strokes, and hopefully, people that have heard this know sooner the better. Get hyperbaric oxygen. It is the most powerful therapy to improve whatever debilitate, whatever disability you've acquired from the stroke, and again, I think that's going to help a lot of people.
But even when it's late, as these cases showed, and all of them that we treated when we started, were years out.
Yeah. Don't avoid it.
It's never too late.
Thank you. Thank you again.